What I thought would be a good idea is periodically we'll try to post some videos of some interesting things veterinary wise that would be helpful to the pet owners and our Facebook friends, etc. And so the first thing we're going to cover is dental care. And we had a dog that presented a week or two ago, a little poodle mix, just 11-year-old dog. And upon exam, we found a little lesion or an open sore on the right upper cheek area. And further exam showed that the teeth were quite infected and quite sore and very strong odor to them. So as we examined the dog, we found the teeth to be in pretty poor shape. And the dog was in this morning, and we went ahead and performed pre-anesthetic blood work, and we put the dog on IV fluids, surgical monitor, general anesthesia, and performed a dental cleaning and extractions. And we're going to show you how the teeth looked after we pulled the teeth. We ended up pulling 23 teeth from the dog, and essentially the teeth were, as you can see, in not really very good shape. And there's two more that are missing. Now there are premolars, molars, canine teeth, and also incisors. And the good news is the dog's going to do a whole lot better without those teeth than he did with the teeth. The pain must have been excruciating for the dog, the infection also as well. So one of the most important things we talk about in vet medicine is dental disease. There was a retrospective study that Purdue did up in West Lafayette, Indiana, the veterinary school, and they actually found a link between, and they followed, there's either 4,000 or 5,000 dogs over the course of years. They followed these dogs along, and they found indeed a link between what we have said for years. So there is a definite link between dental disease, heart valve disease, kidney disease, etc. So my whole thrust and my whole approach to dental care in vet medicine is preventive medicine and trying to brush your dog's teeth and cat's teeth. And the specialists do encourage us to brush our pet's teeth every day, which is a little tricky, but you can do it. And the best way to do that is get started when they're about 6 months old, when the adult teeth have come in. And there are a lot of products and a lot of kits that you can use. One of the best ones that I like is CET. It's an enzymatic toothpaste. It takes about 5 minutes to utilize. And that product, you apply it on either a finger brush or the little small brushes, and you just brush gently on all the teeth. And you start with the incisors and work your way back to the molars and premolars. You don't necessarily have to brush the inside surface of the teeth. And so the benefits are very, very important and definitely outweigh what we had with our little guy here. Now he'll do fine. In fact, he'll be probably feeling 90% better when he goes home today with his antibiotics and his pain medicine. We'll feed him softened food for maybe 3 to 5 days, and he'll come back and we'll recheck him in 2 weeks and make sure he's doing well. And so hopefully this helps to encourage you all to look in your dog and cat's mouth, and every year and every time you go see your veterinarian, he or she will examine the mouth. And that's one of the important things for taking your pets to the veterinarian, not just for vaccines and what we call routine care, but also to have the animal completely examined, to have the teeth checked, and hopefully prevent something like this from happening. So hopefully that helps. Thanks.